Perverse incentives in healthcare. Medicare reimburses doctors at a higher rate if they administer more expensive medications to treat a condition. This creates an incentive for the physician to prescribe a more expensive drug when a less expensive one might do. Payment for treatment generates a perverse incentive for unnecessary treatments. In 2015, a Detroit area doctor was sentenced to 45 years in prison for intentionally giving patients unnecessary cancer treatments, for which health insurance paid him at least $17.6 million. Unnecessary treatment may harm in the form of side effects of drugs and surgery, which can then trigger a demand for further treatments themselves. Volume-based care over quality. Healthcare providers are often reimbursed based on the number of services provided rather than the outcomes achieved. This can lead to over-testing and over-treatment, where doctors might order more tests or procedures than necessary to increase their revenue, even when these might not benefit the patient's health or could lead to unnecessary exposure to risks. Fragmented care in systems where different specialists are paid separately for each visit, there's little incentive for coordination of care. This fragmentation can result in redundant tests, conflicting treatments, and missed opportunities for preventive care, potentially leading to poorer health outcomes for patients. Fee-for-service model in chronic care. For chronic conditions, the fee-for-service model can incentivize more frequent visits and treatments rather than effective management, which might reduce the need for such visits. For instance, managing diabetes with frequent medication adjustments instead of investing in comprehensive lifestyle management programs which are less reimbursable. Incentives for hospital admissions. Hospitals might be incentivized to admit patients rather than treat them in outpatient settings due to higher reimbursement rates for inpatient care. This can lead to unnecessary hospital stays which expose patients to hospital-acquired infections, deconditioning, and other adverse events, all of which can harm patient health. These incentives within the healthcare system often stem from how payment structures are designed, focusing more on the volume of care rather than the value or effectiveness of care, which can inadvertently harm patient health while benefiting the financial interests of healthcare providers.